MATRx plus titration trays, preparing impressions. This MATRx Plus video will review how to take tray impressions, how to trim the impressions to ensure proper tray function, and how to optimize tray fit, retention, and comfort. We recommend using a fast-setting blue bite impression material. The following impression procedure will ensure the patient's natural bite position is maintained during tray use. The upper tray impression should be taken first. Fill the tray with a generous amount of impression material. Insert the tray, ensuring both patient and tray midlines are aligned. The scale of the tray should be facing upwards. With gentle but firm pressure, push the tray against the upper teeth and hold the tray in place until the impression material sets. Once the impression material has set, slowly remove the tray and inspect the impression to ensure everything has been captured. Signs of a good impression and proper tray size are: 1. Maximum bite depth into each tray. 2. Minimal areas of show-through. Too much show-through could mean the tray is too small. 3. Minimal amount of impression material left in the tray. If excess impression material is present, this could mean that the patient did not bite down far enough. 4. Patient and tray midlines are aligned. After taking the upper tray impression, excess impression material needs to be trimmed to ensure the trays will move back and forth easily during the study, and to optimize tray fit and comfort. First, trim the excess impression material from the lingual aspect of the tray. This will maximize the space available for the patient's tongue. Remove any sharp edges, being careful not to remove material from inside the retention grooves located along the sides of the tray. Next, trim all the impression material from the bottom of the tray. This will allow the upper and lower tray to slide against one another easily. Now trim excess impression material from the molar ends of each tray. This will prevent tissue impingement and allow the patient to fully protrude and retrude their mandible comfortably. On the buccal aspect of the tray, trim all excess impression material, again being careful not to remove impression material from inside the retention grooves. To optimize comfort, ensure that all surfaces are smooth. In most cases, the impression material in the vestibular area will not require trimming. This will aid in both tray retention and comfort. Proper tray trimming will result in: 1. Maximum space for the tongue. 2. Easy back and forth movement of the trays. 3. Optimal tray comfort. 4. No tissue impingement. It is important to place the trimmed upper tray back into the patient's mouth to confirm tray fit, retention, and comfort. This should be done with the lower tray connected to ensure both trays are positioned correctly. With the trays in place, instruct the patient to gently close their mouth. Ask the patient if the trays are comfortable and check the fit. Ensure the patient can slide the mandible back and forth easily and that the mandible is not shifted to the left or right. Remove the trays, verifying adequate retention of the upper tray. Now we can take the lower tray impression. Fill the lower tray with a generous amount of impression material. Insert the trays and instruct the patient to firmly close their mouth and bite into the incisal groove of the lower tray. Ensure the mandible is not shifted to the left or right and that the patient is comfortable. Hold the trays in place until the impression material sets. Gently remove the trays, verifying adequate retention, and inspect the lower impression to ensure everything has been captured. Verify the quality of the lower impression and then, as demonstrated with the upper tray, complete the trimming procedure. After both trays have been properly trimmed, place them back into the patient's mouth to check tray fit, comfort, and ease of tray movement. Retract the tissue on both sides of the patient's mouth to ensure there is no tissue impingement. Ask the patient to confirm that the trays fit comfortably. Next, check the tray retention. Ask the patient to try opening their mouth. There should be some resistance, The patient should not be able to open their mouth easily. Also check for ease of tray movement. It is very important that the patient can comfortably protrude and retrude their mandible. Ask the patient if there is any pinching or discomfort. The impression procedure is now complete. Let's review some important points. The molar ends of the trays and impressions should not extend beyond the mesial half of the most posterior teeth. All excess material from the lingual aspect and the bottom surfaces of the trays should be completely free of impression material. All sharp edges should be removed. Do not over-trim the impressions, as this could cause loss of tray retention. In most cases, trimming of the impression material into the vestibular area is not required, since this material aids in both tray retention and comfort. Upper and lower patient midlines should be checked to make sure they are representative of the patient's bite.